We need one because at this point, Black women are dying 3 to 4 times the rate of white women in pregnancy-related deaths and complications. And actually, depending on where you are in the country, it might be as high as 8 or even 12 times the rate of white women. We have had this problem for a very long time. And as a matter of fact, out of all the developed countries in the world, the US has only, maternal mortality has increased versus all the other 20 that have gone down. We also spend a ton of money on healthcare. And so why aren't we seeing better outcomes, and better outcomes, especially for the disparities with Black women? And so the hope and the dream with having a Black Maternal Health Week is that we can get some more focus and start to address this problem from all the different ways, right? Because it's bigger than trying to just fix maybe one clinical person. We need to fix clinical systems, maternity care systems. We need to work on policies for families. We need to also, as a community, as a society, really value maternity care a lot differently than we do now. The CDC just started to now acknowledge racism's effect on maternal mortality. Now we're having the bigger, broader conversation of what racism's effects, and racism is huge, right? It's about power. It's about time. It's about systems. It's about, interpersonal interactions. It's wide and broad. And so I think that we're starting to understand that while we can talk about maybe social economic differences, can we talk about redlining? Can we talk about food deserts? When we want to talk about more so, for example, vascular diseases like hypertension and diabetes, and why you see more of a prevalence in this Black community. It's not race, it's racism. We're talking about more now the effects of chronic stress and what that does on the vascular system. And there's already documented research looking at how one stressed individual stresses out the next 4 generations. And I don't need to do that math for you. And so now we are finally having the harder, broader discussions of, this very touchy topic. And, for me, I'm not scared anymore. I'm not scared anymore to talk about it because it needs to be talked about, because it affects everything. I think what we're talking about is how Black women feel like they're not being heard. And then also acknowledge the fact that we still have a lot of systems that believe a lot of different medical myths, like physiological difference, that Black women have a different pain threshold or thicker skin, which are all lies. And so what I say to, my family, people that I get in contact with that are Black birthing individuals going in, is if you feel like you're not being heard, change your provider. Make sure that you don't have to stay with them. If you're not being heard, leave. And that's where it also comes from, the fact of what I just said earlier, is we need to demand better and demand more. Know that this is a problem. Know that we all have a role in trying to change these outcomes. Florida is known for a lot of amazing birth centers. Use them, especially if you're low risk, and capitalize on all that wonderful midwifery care that goes on in Florida. I think if you are a reproductive, active, that's the way I'll put it, family that's planning to expand and grow your family, demand better, demand more. Make sure that your insurance companies know that they should cover all of the things that you want, that you need, whether it be midwifery care, a doula, lactation. Demand and expand, demand more. So we're one of the most developed countries that don't have paid family leave. Can you imagine how much different your life would be as a parent if you knew when you had a baby, you and your partner had a year of paid leave, how you could parent? Come on. So when you have the opportunity to join any kind of movements or conversations about paid family leave and supporting that, try to jump out there for that. And then talk to your policymakers. Are they aware that this is an issue that they need to address? So common when I've done congressional briefings, I have representations from different states. I'm not going to shame anybody today, but who act like this is, not much of a problem or nothing that their constituents are worried about. Let them know that they should be worried, because honestly, the value of a country from an economic standpoint is how well their mothers and babies are doing. We are not looking good, y'all. We are not looking good.